My name is Claudia Quintero, and I am with Seek Common Ground, and I'd like to welcome you to our learning community talk on the challenges and opportunities for mental health services in rural America. Today, we will be hearing from Sanford Johnson, Executive Director of Teach Plus Mississippi, and Misty Cole, Infant and Early Childhood Mental Health Cross Systems Integration Manager with Hopewell Health Centers in Southeast Ohio. You can find some more information about both of them in the chat. Misty and Sanford are joining us today to share their perspectives and experience in grappling with the mental health needs of rural Americans, more specifically in the Appalachian region of Ohio and the Mississippi Delta, from preschoolers to students to parents and advocates and educators. While managing several action accelerators over the course of the pandemic, and for reference, the Action Accelerator is our process of funding community-led projects supported by a learning community of fellow travelers, resulting in research and other information on salient topics. We have been reminded time and time again of the critical importance of both recognizing and addressing trauma and the mental health needs of our school communities. Even as we have, and more importantly, our supported projects have, sought to address these issues, the unique needs of our rural communities have gotten less attention. We can't solve the wide range of issues in this area that need to be addressed, but today we're providing a forum for two exceptional practitioners dedicating their careers to grappling with these issues to share their perspective. So today I will pose questions to both of them, and then they'll take over the conversation. We are recording today's talk, and we will make the recording available on our website by the end of this week. At the end of the discussion with Misty and Sanford, we'll continue into overtime for the second half hour for an off-the-record discussion that we invite you all to participate in. Danielle Gonzalez, Executive Director of New Mexico First, will kick off our overtime session as the lead discussant, commenting on Sanford and Misty's take from her own perspective of rural New Mexico. So with that, I'd love to kick us off with our first question. And so to get started, just ask each of you to tell us a little bit about yourself, what drew you to this work, and what you think is the importance of mental health supports for children, students, educators, and families. So how about we start with you, Sanford?
Hello, my name is Sanford Johnson, Executive Director of Teach Plus Mississippi. I get to work with an amazing group of teacher leaders all across the Magnolia State. What really drew me into this work is actually how I started this position. My first day at Teach Plus was the first day of the pandemic. So I have only known this job through the pandemic. And one of the first things that we worked on was a survey where we surveyed about 2,400 teachers across the state to find out what are your challenges related to the pandemic, and what do we need to consider as we start in the fall? Because you remember there was one time where we thought that this is just going to be a couple of months of a disruption, and then we're going to come back in the fall. You know, and how have we been impacted by those 3 months? That's how it started. Well, we know that that was wrong, but one of the things that really stood out, our teachers were really concerned about the mental health needs of their students. They knew that students were going to be isolated. We knew that students weren't going to get the help that they needed during that time. We also knew that students were going to be facing abuse and trauma, and how are teachers going to be able to address that? Teachers were also dealing with the same issues as well. We've noticed that ever since that survey, when we did focus groups with teachers around ARPA spending, what is your number one concern? Once again, mental health was another concern. So we're trying to address the needs that teachers see within their schools, within their districts, within their communities. We think that there is an immediate need, and then there's a long-term need. So immediately, we need to make sure that teachers are prepared to identify students who are facing mental health challenges and get them the resources that they need. And then long-term, there needs to be a conversation around how do we build a better mental health system? And that's going to mean a partnership between teachers, counselors, administrators, outside service providers. And right now we don't have that system in place. So would love to get some ideas on how we can build that system in Mississippi.
Wonderful. Thank you, Sanford. And Misty, how about you?
Thank you. It's good to see you, Sanford, and always to listen to your perspective. Our thoughts on this are pretty similar. I actually started my career as a preschool teacher, And one of the things that I found myself saying over and over again was, I don't know if I want to do this anymore because children have changed. And I went to a training and I said that, and someone informed me that children hadn't changed, but childhood had. And that was a real realization for me, that children are dealing with things that they've not had to deal with previously. And then that was pre-pandemic. So on top of that, we had the pandemic response. And what we've found throughout the work as well is we need healthy adults who are identifying these mental health challenges in children, who are offering supports for children. And so we've done a large focus on adult resilience and how do we take care of those who are doing the caretaking, right? And just really kind of adding to the adage that it takes a village to raise a child, but it takes a healthy village to raise a healthy child, which is one of the comments from Nefertiti Bruce Pointer, who works for the Devereaux Center for Resilient Children. So it has just increasingly become an interest. And we, as Sanford does, hear the concern that people have over and over and over again in conversations about needs.
Thank you so much, Misty. And to that point, what keeps you up at night? And I know you've been doing this for some time, but right now, what's keeping you up at night? And what are some of the common misconceptions that people have about mental health and about your community in particular?
So I think, really, again, speaking to what Sanford said, the systems that we have a lot of systems work to do. We have a lot of things that we need to ensure are happening so that we can have healthy communities and a healthy nation, healthy schools, healthy professionals. So understanding the magnitude and the gravity of that work is what keeps me up at night, but also gives me job security, right? So it's one of those pieces that when you really look at the magnitude, it's just an incredible challenge to think about moving forward. But again, it allows us to focus on some of those misconceptions that are out there. It allows us to look at ways that we could address stigma related to mental health. And I think that's a really big one. We have been blessed in Ohio to see a lot of cross systems work, which is where my position comes in. And we're now integrating infant and early childhood mental health into our pediatric offices. And we're training nurses and doctors and practitioners across boards to see that. And the idea is really that we start addressing mental health as soon as a child leaves the womb. When they go for a well child checkup, we're not only looking at their physical health, we're not only looking at growth and weight and height, but we're also looking at attachment. We're also looking at initiative. We're also looking at those pieces and offering supports so that we're in a preventative place instead of a place where we're trying to clean up something that could have been prevented.
Thank you, Misty. And how about you, Sanford? What's keeping you up at night on this work, and what are some of the challenges you're trying to address?
I think it goes right back to systems. I'm really concerned about how the systems are working at the school and district level. There seems to be a lack of structure in terms of who's responsible for what. And I think because of that, folks end up doing roles that they may, like somebody else may be doing. For example, like you hear from counselors, and a lot of school counselors are doing academic, like scheduling work. They're doing test prep work instead of counseling kids. And because there's a gap there, that means social workers are called in to do more of the direct work with addressing with the mental health needs of students. And there's some tension around, should it be the counselors or should it be social workers? So what roles do those two groups play? Meanwhile, what roles do teachers play in all of this? And I think because we don't clearly define, you're responsible for this, you got this, and you got that, then there's a lot of friction, there's a lot of infighting. It gets worse in some districts than others. So what we're trying to do is figure out what districts have done a good job of making sure that all the needs of the students are met by the different groups in the building, and how do we share those best practices with other districts.
Thank you so much, Sanford. And on that point on best practices and where things are working, Is there anything that you're seeing so far, and either one of you can answer this one, but are there any things that are giving you hope in this moment in terms of what's working and what's really helping your community in terms of mental health support?
I'll briefly, there have been a couple of teachers that I know have been through the mental health first aid training. In fact, that's one of the things we focused on during round 2 of the Action Accelerator, is to make sure that teachers go through that training, and it was phenomenal. I even went through it myself. I think we're going to see more teachers that are going through that. I think there are some other opportunities for them to incorporate trauma-informed practices into their instruction. So I think that's something that is giving me hope. I think that's something that we look to see more teachers getting access to.
And I think for hope on my end, it's really seeing that cross systems work occurring and people really recognizing and realizing the impact that mental health has and putting some workforce behind that. I feel like there have been a few people throughout the last couple of decades who have been really pushing mental health in general. And now it's really catching on in a way that we can have conversations. And while there's still a lot to figure out, at least the conversations are starting.
Wonderful. Well, that's great to hear. And I'd love to open it up to you both to ask each other questions for the next minute or so. I don't know if one of you all have, when you're ready to jump in with, to ask of your fellow panelists.
Yeah, I will get started if you don't care, Sanford.
I don't care. Go ahead. That's fine.
I think one of the things that I'm really curious about is I know you're doing a lot of advocacy work, and I know that that is kind of a ground up process, and that a lot of the things that you're doing and seeing are pretty cutting edge, really. And I'm just wondering what that advocacy looks like and how you're gaining momentum.
I would love to say that we're gaining a ton of momentum. It has been a challenge because our first 2 years, what we've been focused on was legislation. What we wanted to do was see a law passed that required districts to address the mental health needs. And there were a couple of different areas that we were looking at, making sure that there were minimum standards around what trainings would be available for teachers, how are we screening students and identifying mental health needs. We were also pushing the Department of Education to provide resources for districts. We were not able to get legislation through. I think there were just other priorities that came through. And now we're at a point right now where we're trying to figure out if legislation is the right way to go. Like there's a benefit to it. So legislation, like districts will listen if there's a state statute mandate, but that may limit what we're able to actually get done in schools because, you know, for a lot of people, like there are some legislators who are caught up in the word trauma and they don't understand what it means. It's been caught up in some of the anti-critical race theory rhetoric that's been going around. So we're wondering if we can get more done if we sidestep the legislature and maybe do more work with the Department of Education. So that's something that we're considering. Not saying that we're completely done with legislation, but I think we're just being more thoughtful about what do our schools actually need, what do our students, what do our teachers need, and what's the best way to get our schools there. I think, I'll stop there. So one question I had for you, because I know that you've done a lot of work, not only locally, but at the state level around building better systems. So I'd love to know what are some of the lessons that you learned around the systems work in Ohio, and what are some of the things that we can steal down here in the Magnolia State?
Well, we would love to help in any way we can. I think one of the best lessons that I've learned, and really the creation of the position that I'm in right now, is that when you're looking at a statewide initiative, the same message needs to be given across systems, right? So it's not effective for mental health to be giving one message while education is giving another message, while pediatrics is giving another message. But the idea is that we're sharing the same messages about the importance of mental health across the lifespan within each system so that we are consistently moving forward as a state. We have had the opportunity, as I mentioned earlier, to work with our federally qualified health centers here in Ohio. We have state support teams, which support our school districts in 16 regions in Ohio, where we've been able to integrate early childhood mental health into those systems. We're also integrating into our developmental disability systems. And Ohio did a great job of, through the work of Dr. Valerie Alloy, working on an early childhood mental health credential for the state. And it does not matter what system you're with, every system goes through the same credentialing process. And in that credentialing process, there are mandatory trainings that have to be taken. And there are only 7 people in the state who give those trainings. So the same message is just being given across the board. And I found that for consistency and also for buy-in, that is one of the most helpful pieces that has kind of grown as the process has happened over the last 10 years or so.
Going back to one of the concerns that we had around some of the tension between counselors and social workers and other providers and teachers, have you seen some of that same tension, and what were some of the things that happened in Ohio to help overcome that?
Yeah, I think there's a lot of tension for sure. I think it's a really deep challenge. It has been exactly what it is that I hear you doing when you talk about the efforts that you are putting in place in Mississippi. It is the tough conversations. It is the asking people what they need. It is the groundbreaking approaches that come out of a need. And those of us who are doing the work see the need, right? There is no way that we can overlook this need for mental health supports in our nation, but particularly in our areas that are underserved anyway, right? So in the Appalachian region in Ohio, we have twice as many instances of depression, opioid addiction, suicide instances, but we have half the number of mental health practitioners. And so as we have looked at these staggering numbers, it has become a necessity to do the work, right? It's no longer a choice or an interest or a passion. It is a necessity for the wellness of all of our communities. And so I wish that I had just something amazing to give there, but it's hard. And it is really takes a lot of consistency, and it takes being able to share the struggles, and it takes, trying something that doesn't work and then regrouping and trying something new. And when you mentioned kind of foregoing the legislation and talking to the Department of Ed, a lot of our work is right now through the Department of Ed. It is a partnership between mental health and addiction services and the Department of Education, where we say we all have the same desires, we have the same goals. How do we get there? And that is not working independently. It is really pushing that team process.
One thing that I'm hoping to add to our effort is student advocates. I am a board member for Teen Health Mississippi, and I've been involved with their work around sexual and reproductive health for years. So they are also focusing a lot on the mental health and wellness of students. And I would love to see students being a part of this too. For example, with the toolkit that is being created, we have a couple of our members who are part of the toolkit writing committee. They're drafting it right now. What we're hoping to do is to provide feedback on that. So here's what teachers think about it. Here are the strengths, weaknesses, ways that we can improve it. We would love to see counselors be able to do that, social workers to be able to do that. But we'd also love to hear from students so they can go through the toolkit and see these are the resources that we need. This is what's missing. And I think that information is going to be helpful. I'm also hoping that once the toolkit is created, we'll be able to get district buy-in by creating a self-assessment where districts can look through and see, this is what we have, this is what we need, and this is how we can use the toolkit to fill any gaps that we have. And we're hoping that students are going to be a part of that process as well.
So now you've got my interest really piqued, Sanford. I'm just interested in the toolkit and what has been the response from educators. What has been the response from people who have seen that? And how are you utilizing that feedback in order to create and change as needed?
So it is early, so we are still in still in first draft mode. What we're hoping to do is, as it's being created right now, and what our fellows are working on right now, is to look at toolkits all across the country to find out what are the things that need to be included so that we can share that information with the Department of Education. And then once that draft is created, which we expect by the end of the year, maybe a little after that, then we can conduct focus groups with teachers to find out, okay, what do you like? What would you change? So I think it should be a process that we should be able to wrap up in the next couple of months. So I may be reaching out to you soon to see if y'all have any good toolkit examples that we can share in Mississippi. I'm not going to say steal, I'm just replicate.
No need to steal. We will share. We play well in the sandbox. We play well in the
take
sandbox.
it deep fried, like Mississippi style. You know, that's how we do it down here.
Absolutely. And I certainly support that for sure. I love just from a standpoint of kind of still being in the middle of this process, but being through some of those beginning pieces. I just love the fact that you have integrated the thoughts and ideas of other people and that you have a plan moving forward for getting that feedback. And anytime I think that we can have student representation and have our student voices heard, I think the better. And I think that that's the kind of thing that helps legislators, that helps the big departments across the state really start to hear what it is that we have to say. When our children are reaching out and saying we need mental health supports, how much more valuable can it get, right? And then it's easy to make that jump and say, not only do we have these kids who are saying we need support, but we have these teachers and these administrators who are doing the really, really hard work of supporting kids who need help. And they need help too. And I know we've talked about before, and I just always think it's such an important piece to bring up, is that that self-care piece. And as we've focused on self-care in Ohio, again, one of those thoughts has been that oftentimes when we start talking about self-care, it's too late, right? Because at that point it's aftercare. But with what you're doing in Mississippi, you're starting with kids, right? And starting to put that into place so that it is just a practice. And it's not unusual, and it's not an aftercare, it's preventative. And I'm just so encouraged by that. So I think I want to go back to one of the first things that Claudia asked us, what gives us hope? Getting to talk to people who are doing this kind of work and hearing the things that you guys are doing, those are some of the things that give me hope as I see other people working towards the same goals.
Well, I feel the exact same way, and I'm so I admire the work that you're doing in Ohio. And as I mentioned, I would love to get up there and see that work in action, because y'all have been a real inspiration to us down here in Mississippi. One other question I wanted to ask you was around legislative support, and not just the legislature, but the State Department of Education, the governor's office. What has the reception been like? Has there been pushback, and how have you overcome that pushback?
So we have been just incredibly lucky. And that is really the only way that I can say it. We had some phenomenal supports at the Department of Mental Health and Addiction Services with an early childhood department. And we had a couple of leads there, Dr. Valerie Alloy, who had some support in the governor's office. And so while we started out grant funded, originally the Race to the Top Early Learning Challenge grant, and then as grants do, they go away. And then it became the Whole Child Matters grant here in Ohio. Once the governor's office saw the work that was being done, and we have an incredible database. And I would say that's one of the things that I would suggest, data. Because once you can show the impact of the work, it really makes a difference. And now early childhood mental health is a line item in our governor's budget. And I know that not everyone has that support, but I really think that The visionary work of saying, when we start this, we need to have the numbers was really helpful, right? So we were able to say, you know, we've served over 90,000 kids in Ohio in the last several years. We were able to say, disproportionately, we know that young Black men are being expelled and suspended from preschools. And through these supports, 97% of those young men have been retained in their early learning settings. Once you can get those numbers backing the great work that you do, you can put a spin on it that can interest just about any group. And I have found that probably to be the most helpful. So if you don't have a database at this point, or if you've not started thinking about those pieces, I really think that's an in. I think that is probably one of the most helpful things to get the work integrated across systems in Ohio, was having those numbers.
That is something that I am really interested in. Our State Department of Mental Health has it's been going through some challenges, to say the least. There's a federal court order that sort of requires them to do things better. I know that the different mental health regions, some are stronger than others. I think there's some real challenges. The one that we're dealing with in the Delta, and lack of data is a major issue. And there's some real concerns about, you know, we say that, you know, we want to connect students with service providers, but there's a real question about whether students are really going to get the care that they need through those service providers. So that's another systems problem that we're going to have to change. There's one other thing that you mentioned, and it was around discipline. And I'm wondering, like, can you say more about some of the resources that are available to teachers and other youth-serving adults around discipline and classroom management? Like, what are y'all doing up there around that?
A lot of the work that we're doing is all trauma-based, and I know you mentioned that earlier. One of the big initiatives that we've had in Ohio is that trauma-informed care approach. And along with the early childhood mental health credential and the infant mental health credential, Ohio also adopted a trauma-informed care certificate, 3 different levels where folks go through various trainings, various supports. Each region of Ohio has a trauma-informed care collaborative. And our goal has really been to get out the information to teachers that behavior is a form of communication, and whatever a child is doing is letting you know something. And a lot of times that is related to trauma. And so we have really, rather than the focus being on the disciplinary piece, we have focused on helping people understand how to build trauma-informed spaces, so that all children, whether they've experienced trauma or not, have the best opportunities to be successful in that space. And we've seen a really remarkable response to that. Classrooms just feeling better, teachers feeling better, and children feeling better. So that has probably been our overarching look at this point, has been really adopting trauma-informed care across our educational systems from preschool and beyond.
That's excellent. Thank you.
Wonderful. Thank you so much for this conversation, and we're definitely not done. I just do want to make sure that I ask you our kind of closing recorded question here, which is to just ask each of you who's been someone who's influenced you and why, and then we'll continue this conversation in the overtime. But Sanford, I don't know if you'd like to go first on who's influenced you and why, and then Misty, you can close.
So there's another group of teachers that we've been able to work with around mental health, and those are our SEL change agents. So we received funding to set up change agents in 4 different states, and Mississippi was fortunate enough to be one of the states that we were able to work with. We're working with teachers in the Jackson Public School District. It has been great to work in that district because teachers have been really invested, and sadly there was a situation, unfortunately, there was a student who died by suicide in a very public way, a very traumatizing way for a lot of students and a lot of teachers within the district. And it sort of highlighted the need for, like, we need to address this. There have been some teachers who've been able to come up with some amazing projects. They're going to actually wrap those projects up next month. Everything from mediation for students, working on mental health needs for teachers. There are folks going back to early childhood, helping young children in pre-K learn how to identify their emotions and how to properly express those emotions. So we've got a group of about 7 change agents in JPS that are doing amazing work, and I look forward to highlighting some of the things that they're doing, because they've just been amazing, and I think we're going to learn a lot, and hopefully some of the ideas that they're coming up with in JPS are things that we're going to be able to do across the state.
All right. I think I just was going through a number of different people in my head, right? Everything from my mom to my children to the professionals that I work with. And I think that for me, a big part of this journey has been raising kids in a really tough world. And so I think that watching my children face the things that they faced across their ages, right, from the time they were in preschool to elementary to junior high to high school and now young adulthood, it has just really encouraged me that people need supports and they need safe spaces and they need somebody cheering them on and they need someone who believes in them even on their toughest days. And so I am hopeful that as I have grandchildren, my first one March 30th, that we are creating a much better world for the children who are to come, and that we will be addressing mental health in a way that is part of life, not an extra piece. And so that's my hope, and that's my inspiration.
Wonderful. Well, thank you both, Misty and Sanford, for your insights, your conversation, your reflections, and the work that you do every day for your communities.